Now, we will discuss why we are required to record a Facebook for a particular patient. The opening movement of the opening movement to bring the jaw from occlusion to the rest position is almost a pure rotation movement. Here the mandible moves on an arc of a circle with a definite radius from the TMJ joint. This path of the condyle is determined by the curvature of the condylar head and the curvature of the glenoid fossa of the temporal bone. In diagram, it can be easily depicted that when mandible moves against the maxilla, it moves in an arc shape. Since the radius is not constant for all the patients, it has to be determined for every individual patient. Relation of maxilla to the opening and closing axis has to be determined for particular patient. Opening and closing axis can be located when the mandible is in its most posterior position by means of a phase bow. The relationship of maxilla to the cranium in three planes, and they are anterior, superior, anterior-superior, lateral, and vertical. Where phase bow is used, where the balanced occlusion is in eccentric position is desired. Advantages: it is easy and efficacy of use. In use, sterilizable parts, one piece, low maintenance design, adaptability to other articulators, direct and indirect mounting capability, and it has the lower cost also. Disadvantages: it has the inability to measure the intercondylar distance. Why to record and transfer hinge axes? It allows the centric relation record in dentulous situations to be accurately mounted onto the articulator with the use of interocclusal centric record. It is a straight point of lateral movement, allows the transfer of the opening axis to the articulator so that occlusion would be on the same arc of closure as the lower jaw in the patient's mouth. Opening and closing movements of mandibular are reproduced in the articulator because the opening axis of the articulator is coincident with the hinge axis of the patient. Therefore, the teeth contact each other on the articulator exactly as they do in the patient's mouth. Now, procedure to record arbitrary hinge axis. First, the bite fork is prepared, and bite fork is prepared. Then it is inserted into the rim, and it is locked over the bite fork. Then the bow is prepared. The patient's application, first is it is inserted in the patient's mouth. Bite fork is inserted in the patient's mouth. Then the U-shaped frame bow is inserted into the external auditory meatus, and then the orbital pointer is coincided with the infraorbital notch, and anterior reference point is also in contact. Then we have to do it mounting. Now, mounting is of again of two types, that is direct mounting and indirect mounting. Now, this is the procedure for the direct mounting, and this is the procedure for the indirect mounting, which is done on the articulator. Other methods of recording hinge axis are pantograph, two phase bows. One holds the 6 recording tables attached to the mandible, and other with 6 stylus attached to the maxilla. Transograph and stereographs and computerized axiograph. Thank you.